Okay, it's spicy time. Oh man, it's a tale as old as time. Songs as old as rhyme. It's the AMA once again punching down on pharmacists. We're not surprised by this, but a recent article was published by the AMA talking about what the difference is between pharmacists and physicians, and doesn't really answer this question, but more so just talks about the gap in education between the two professions. And this is in light of, I believe this is an article in opposition to the bill that was put forth to have pharmacists be allowed to provide Paxlovid for COVID diagnosis after a lab test. Um, and I would love your take on this. Let me know what you think about the AMA talking about this. You pharmacists out there, if you're a physician, hey, welcome. We like you as much as you like us. You're fine. You're welcome here. And I'm totally open to different opinions. Now, just a little bit of context before we get into this. I am a pharmacist. I am not a scope of practice expert for pharmacists. I'm also not a physician. Um, I don't really have um, a horse in this race. I um, I think scope of practice is probably good for our profession overall, but this is driven by professions. This is not driven by market demand. So at my core, I'm a career coach. I'm a student of labor economics. I am a big believer in the market driving the profession. And so when I hear scope of practice, I think, okay, it's an option for pharmacy to move forward in, but the free market is not demanding this. So I don't believe that it is the savior that many pharmacists believe scope of practice to be. That's controversial. Some may disagree with me. That's fine. That's fine. It's not that big of a deal. Excuse me. I am sick today. I've been sick for 2 weeks. So I'm coming at this from a little bit of an outsider perspective, but I still have my biases, and I'm gonna get into this article. So they published this about 2 weeks ago, and they start off by talking about how education matters much more than convenience. Yes. I would rather have my broken leg treated by a trained professional than a snake oil salesman. I think that goes without saying. Patients notes too. More than 90% say a physician's years of education and training are vital to provide opt- optimal patient care. Fine. Makes sense. Nonetheless, legislation seeks to allow pharmacists to diagnose and treat patients over the pharmacy counter, relying only on lab tests, the same lab tests that you would do in a physician office. But this would put patient at risk, and an isolated lab test depicts only a sliver of a patient's overall health, not enough to determine the course of treatment. In addition, pharmacists are not trained to diagnose patients. The lowly pharmacist. This is all setting the stage for the AMA to basically state that pharmacists are not educated enough to diagnose and treat patients. And I think this is so interesting because if you put that within the context of what is actually happening in the medical community, if you're a patient and you have COVID, and you want to go into your local clinic, there's going to be a huge delay. Maybe you have to go to urgent care or even the emergency room. And what are they going to do? They're going to go through a checklist. They're going to have the nurse examine you, take your vitals. They're going to do tests. And if it's positive, what are they going to do? They're going to treat you for COVID. They're going to treat you for COVID. And yeah, of course, there may be something else going on. Yes. And if that is the case, then I think what the bill that would seek to give pharmacists provider status in that case, they're going to account for that. They're not just going to check boxes for COVID, but they want to paint this picture that pharmacists are trying to diagnose, and that'll mean pharmacists can be doctors, and we're doctors and we're in control here. That's our job. And I totally agree. In a perfect world, I think physicians would be great at just diagnosing. Just diagnose the patient. Find out what the problem is. And if medicine is needed, then triage to a pharmacist. The professional, okay, who has received way more education than the physician about how drugs work and what they're used for. Correct me if I'm wrong, any physician academics in the audience, but I'm pretty sure that physicians get 1 semester of pharmacology, maybe 2. Oh, but then they get 3 years of residency and they're practicing with it. Yeah, they're practicing it and often not well. Think about all of the studies that are published out there that show unequivocally that for any difficult to dose medication, how much better pharmacists do at it. Antibiotic dosing, vancomycin, aminoglycosides, warfarin. I mean, okay. So we're good at potentially picking drugs. Why not let us do that? It's not like you couldn't use the help. That's not mentioned at all in this article, by the way. They don't at once talk about like, physicians, it may be nice to have a little bit of help. In fact, there's another article here that I got from the AMA, published almost a year ago now, saying like, don't expand scope of practice for pharmacists. They're already overworked. What interesting, like, this is news, but this is propaganda. This is the narrative the AMA wants. So they're saying here pharmacists are overworked. And they don't at once in this entire article talk about how physicians are overworked. Your guys' burnout rates are just as high, if not higher, in some circumstances. This isn't a legitimate argument for why pharmacists can't have some prescribing rights. It doesn't work. It's propaganda. Trained to do different things, they start bringing out the measuring stick. Pharmacists only get 1,700 hours of clinical training, which I think that's based on old data. I don't think that's, if there's any pharmacy academics watching, I think this is different now. By contrast, physicians get 4 years plus 3 to 7 years of residency. That's over 12,000 hours. That's 6 times. I would love to be unprofessional in this live and just be like, what does this remind you of? Oh, this is how long my this all reminds me of history. And I really see doctors kind of like knights or lords from medieval times. They have a certain amount of power over the people. They've been given it to the king, aka the government or insurance or whatever. And this is them grandstanding. This is them trying to do their very best to protect the power that they have. And let's not talk at all about how, and this is not the physician's fault, but let's not highlight how physicians are struggling to do the basic things that they have to do. Let's not talk at all about how much work that they have, how overloaded they are, how long patients have to wait for things. Let's not bring that into the equation. Let's just talk about how pharmacists aren't qualified to do this. So they need to shut up. You guys need to stop this. Stop doing these bills. Stop trying to take away our power. You're not qualified to do this. It's like they're it's like they're fighting. I'm imagining like Smeagol or Gollum from the Lord of the Rings. My precious scope of practice. Yes, it's mine, my own, my precious scope of practice. You'll never get it. It's mine. You're not worthy to have it. Pharmacy education is focused on learning about medications, but not training and providing medical care to patients. Bro, WTF? What? What? Knock it off, AMA. What are you talking about? We don't provide medical care? What are you talking about? We don't provide medical care? We don't teach patients how to use medicine? What? Yeah, my biases are coming out, guys. What are you guys talking about? What is this? How about we're an ally? Like, we're on your team. We don't want to diagnose broken legs, cancer, I don't know, other complicated stuff. But how do you diagnose diabetes? You use a lab test. Only physicians can interpret the glucose. Only a physician can interpret. It's a little bit pathetic, AMA. It's a little bit pathetic here. Pharmacy school curriculum standards do not require exposure to patients with any specific medical conditions or exposure to patients of any particular age. This is a concern because test and treat laws often propose to expand pharmacy code will allow these non-physicians to treat any patient over the counter for a condition they may have never seen before. Pharmacists have never seen COVID before. Oh. Bro, what? We're not wanting to treat, I don't know, hypophosphatasia? It's a rare random disease. My wife has it. We're not wanting to do that. It's COVID. We saw COVID. We were a part of the workhorse to treat that pandemic. I don't know what you guys are doing at the AMA. Who has the role here at the AMA? Chief pushing down pharmacist officer. And then they finally talk a little bit nicer. Okay, collaborative practice agreements, when used correctly, can be a viable solution to allow pharmacists to manage blah, 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 blah. And I mean, I agree with that. But AMA, you are talking in huge generalities here that paint us as untrained, unprofessional, non-medical care, uh, healthcare professionals. We don't provide medical care. So, what I love about this is finally seeing something spicy from the AMA, or I'm sorry, APHA. Um, and I I love seeing pharmacists with a backbone. I think we often are playing the role of subservient profession within the medical community, and pharmacy in general does attract team-focused individuals. Um, if you haven't heard this before, if you have an MD, it also stands for makes decisions. There's a reason why people chose pharmacy and not to become a medical doctor. There are tough calls that a physician has to make, and they often are wrong, but they often are right too. But that attracts a different kind of people, and it creates a different kind of profession. Excuse me for my cold again. So to see a leader write something like this, oof, spicy. And they come out and call it what it is, or a version of it, I guess. Everybody knows bullies don't care what's in the best interest of everyone else around them. They simply are focused on their own insecurities and self-interests. Wow. I don't know if this will fall on deaf ears. I don't know how the AMA is going to respond. Who knows? They may just ignore it, as sometimes physicians do with pharmacists. I'm laughing not because that's awesome or that's innately funny. It's like it's sad funny. And they talk about like what this is really about, which is the COVID pandemic. They talk about, I think they talk about this Pax. No, they don't talk about Paxlovid. I don't think they want to bring that into the discussion. But they want to set the record straight, you know? They talk about how we provide medical care. We were there for the pandemic. We can do more good things. And they also brought up this really interesting thing where back in the 1980s, the Supreme Court ruled in favor of chiropractors providing care. And then they make a ballsy move and basically say every pharmacy organization needs to condemn this. And they ask for an apology. Whoo. Whoo. Politics can be fun to watch, can't it? I don't know if I would want to. And I think there's some really interesting things going on. So Kevin Walker found some comments that people were posting online after this article went live. Absolutely, just put the pills from the big bottle to the little bottle. Want to diagnose and treat no issue? Go to medical school, and we gladly welcome you aboard. Yeah, it I think all of this is grandstanding. It's people. It's a profession wanting to hold on to power, despite the fact that they're overworked, they're overburdened, and we're a profession that's trained to provide medical care, and we could help. I mean, already it's been happening now for 25 plus years, but they're still playing this odd role. I don't know why. I do know why. Yeah, David, it's outdated thinking. It's so odd. It's like, don't you guys have bigger battles to fight? Don't you need to like work on the healthcare system itself? Because it's really expensive, right? It's isn't that like the biggest problem right now? It's ineffective. Quality is decreasing, and price is increasing. So isn't that a little bit more of an important issue than oh these accursed pharmacists? They want to take away our power. What shall we do, master? Write up an article about how awful they are, how dumb they are. Yes. Yes. Then we'll point to how little educated they are, how dumb they are. Then we'll talk about how dangerous it is to give medical care to uneducated professionals. Yes. Yes. um if you're looking for a voice actor, I am for hire. Just kidding. Work on getting more primary care doctors into practice. Yeah, no kidding. Because primary care numbers are down and they're decreasing every year, I believe, for the last 5 years, if I'm not mistaken. Um, isn't that a bigger problem? Isn't like patient care what matters most? Oh, but the quality of physicians are the best. And only we can control the healthcare system. Let physicians be the leaders. They use that phrase a lot in this article. The best way to support high quality care is to keep physicians as the leaders. How weird is that? What a weird argument. We're the best. So like we're the leaders. So pharmacists, you guys, are you kidding me? You're not good enough. There's a reason why you're behind the counter. Yes. Yes. Ultimate power. What does Sidious say in Star Wars? Unlimited power. You guys already have it, AMA. You already have the power. We're on your side. It's ours. My power. AMA's been arrogant for decades. I mean, they have done some good things. That's kind of like me defending Darth Sidious. He unified the empire. Sorry for so many Star Wars references. I don't know if that's lost on some of you guys, but they have done a lot of really good things. They have passed a lot of helpful legislation that have helped patients in patient care. In the area of collaborating with us, there's a lot of work. It's very adversarial. It is, I guess, Mr. Michael Hogue here, president of APhA, calls it what it is: arrogant, self-centered, and out of touch. Yes, it is a huge health system disparities. Health insurance companies, PBMs dictate the model. MDs are seeing that and getting away from primary care and internal type care. Hospitals relying on contracting companies now instead of hiring providers due to lack of it's not a healthy situation right now, right? I mean, Yeah, oh, yeah, you're not saying yeah, I know, David. It is really sad to see them do this sort of thing and put energy and effort into it. I was actually perusing through the AMA, and they have a lot of articles like this. There's actually quite a few interviews. Let me see if yeah, I found one interview with this lawyer who works, I think for the AMA, and they talk about how like a lot of um, laws are trying to be passed to expand scope of practice for not just pharmacists but other professions. And like they talk about how like, oh yes, we won. They didn't pass these laws. Excuse me. So there are people who are being paid to advocate for that and are trying to protect scope of practice for physicians. And I am not, look, I'm not, like I said at the beginning, I'm not a scope of practice advocate. It's not my job that I'm trying to do that for pharmacy. I'm I'm a free market person. So if the market wants something and it can create a job for a pharmacist, then that's what I'm all about. But think, for any pharmacists here, think about MTM. Okay. MTM was lauded as the thing that was going to push pharmacy practice forward. Did it? No, it didn't. It created a few jobs. You could argue that it expanded CMRs in like the world of managed care and PBMs, and that did create some jobs. But we were already going in that direction anyway, and the market doesn't care. My elderly grandparents care that they've got a good pharmacist who's taking care of them and keeping note of all of the medications that they're on, but they don't want a MTM service. And if you don't believe me, talk to anyone at Aspen RX who has the pleasure of trying to cold call elderly patients to get them on the phone with them so that they can go through and do an MTM service. It's challenging. It's challenging. I'm not saying it's not good. I'm not saying that it's not a helpful service. I'm saying that the market doesn't care. So when I think about like this idea of scope of practice, um, I'm definitely on the side of the pharmacist, but I'm also like, what does the market want? And the market wanted vaccines in pharmacies. It was way more convenient. You didn't have to get an appointment. You didn't have to wait. You didn't have to sign off on anything. It was super easy. Um, and it's just I would love it if they would just be a little bit nicer. AMA. So what do you think is going to happen next? I see a few people writing some things in the comments. Do you think the AMA is going to win this battle? Because they're fighting. It's impressive to see how much money and time they are putting into. I'm seeing if I could find a quote here. Yeah, unfortunately, we're seeing a number of scope bills, things like the flu, RSV, strep infections, urinary tract infections. Very concerning for us. Pharmacists play an important role as medication experts, but they're not trained like a physician. They don't attend medical school. They don't attain clinical judgment. I would love it if like they would come to a pharmacy conference and say that in front of like 1,000 pharmacists. Hey, you guys don't have clinical judgment. Oops. Sorry about that. You guys don't have clinical judgment. So odd. So odd. That's the spicy news for this week. Let me know what you think in the comments. I've been enjoying going over the news in this format. Let me know if you'd like me to continue doing this sort of thing. As I get a lot of news articles spread my way, but I don't always have the time to like go over what's happening in the news. More so care about the job market and like what's happening, because it's all about helping people get better jobs in my company. Which, by the way, if you want to know or have a list of companies that are hiring pharmacists remotely, we created a list. I believe there's like over 90 companies on that list. And if you want to just send me a DM and tell me why you want a remote job, send me that DM. Hey, Jennifer, good to see you. How's that interview going? Let me know an update and send me a message in our community, Jennifer. I know that you're a part of that. I'd love to hear an update on how that's going for you. Please don't message me on LinkedIn, Jennifer. I have too many messages to check. So I would appreciate it if you do that. Thank you guys for watching this. Thanks for hanging out with me. Spicy, spicy. APhA calling out AMA as a bully. It's a fun day from pharmacy. Until I see you again, take care.